All right, so we are back with Dr. Mike Van Thielen, and Dr. Mike, welcome back to the channel. It's great to see you again. How you doing?
Thank you. We had a little break with the hurricane, but I'm happy to be back and have another awesome podcast with you, Sean.
Another awesome podcast, and today we've got some really good stuff. We're going to talk about stem cells, and with your background in regenerative medicine, and you've got a lot of history working with those. This is going to be a great conversation. Stem cells are becoming a very popular topic. And, in this day and age, science fiction is actually becoming science fact. And with your background in regenerative medicine, can you kind of expand on where this is going right now?
Yeah, we do live in a miraculous age when it comes to all that, Sean. The technology of the first 20 years of the 21st century approaches that of the technology that we've seen in the original Star Trek series or movies like Back to the Future and the Terminator. Mm-hmm. And medicine and health, they're really not different. The reality is that of our today basically is that mankind has enjoyed the advancements in healthcare in the first 20 years of the 21st century, equaling or even more in those 20 years than the entire 20th century. And as technology continues to advance, it makes more and more sense to merge damaged human tissue with synthetic devices like AI, artificial intelligence, such as computer chips in our bodies, as an effort to forestall the debilitating effects of aging and getting older and disease, right? Mm-hmm. And that does sound like science fiction, but that has been happening for the last few decades. Like for over 20 years now, we've been able to put in computer chips in the brains of Parkinson's patients to help them with some of their debilitating effects of their disease. Also, children with deafness, we've been able to use cochlear implants to help them hear. And of course, we have bionic limbs. Bionic limbs today operate with greater efficiency and effectiveness than our own biological limbs, right? Like Steve Austin in the $6 million man. But if becoming a modern day cyborg is not your cup of tea, because it isn't mine really, there's something else, and that's what's called regenerative medicine and biohacking. And when we go into the field of biohacking, which we'll probably do on our next podcast, Sean, and regenerative medicine, we don't have to now necessarily become a modern day cyborg, but we still can optimize our health, get away from conventional medicine, which continues to harm us, and basically try to objectively reverse our biological age and become superhuman. So that's all available today.
Super exciting. And it's funny that you brought up Steve Austin, because that's my time frame right there. That was one of my favorite TV shows, and we were getting introduced to that in those days back then. So how would you define regenerative medicine? How would you define that as a term that
I define it as a quickly emerging branch of conventional medicine that is really focused on repairing and re-engineering any type of damaged tissue in your body. See, because conventional medicine, as you know, is not doing the job anymore. Drugs and surgeries and injections are just band-aids, right? Mm-hmm. But what we really need to do is we need to start fixing things. And regenerative medicines, mostly stem cell-based therapies, but there's other technologies within the regenerative medicine area, such as shockwave therapy, which we can talk about later. So those modalities, they have been proven because there's plenty of research. Actually, the research in stem cells has far exceeded, or is by far the #1 topic being researched in medicine and science for the last decades. People don't understand it. There's thousands and thousands of research articles coming out all the time. The last time I checked it, there's more than 10 per day being published just in stem cells. 10 per day worldwide, okay? So it's not that it's not being researched, but so now we have the knowledge and we have the research that shows that certain things that we can do actually repair. Last time we talked about repairing our DNA system as part of the EMR, but we can also repair damaged tissues, which could be, our muscles, our tendons, our ligaments, our cartilage, our joints, but also any type of tissue, meaning our organs, our cells, our brain cells, you name it. We have the possibilities to basically repair those, but also renew those, which is another step, because we can fix something that's broken, but then it's still kind of broken but fixed. But we also can fix something in a way like, you know, let's tear down the old house and build a new one. And that's what regenerative medicine does.
So, so today's topic is on stem cells. So what technically are stem cells?
Yes, stem cells were discovered, I believe, in 1979. Don't quote me on that one, in Germany. But then the father of stem cells, Arnold Kaplan, basically started to do a lot of more research into them as a practical application for us. And he kind of discovered the mechanism of action and discovered what stem cells really do and what they are. So the initial school of thought was that stem cells are unlike any other cell in the body in that they have two cardinal properties. Number one, they can replicate themselves, they can duplicate themselves, they can make perfect copies of themselves. And number two, they can become any other specialized cell in the body. In other words, a stem cell can become a muscle cell, a tendon, a ligament, cartilage, collagen. It can become a brain cell, a blood cell, a pancreatic cell, a liver cell, a heart cell. The list goes on. That was the initial school of thought. And so Kaplan called these cells mesenchymal stem cells, MSC. Now, moving forward a few decades, probably within the last decade, a lot more research has been done by current researchers on the mechanism of action of these cells. And they basically found that whatever Kaplan initially thought is probably really not what's happening. So what's happening now, what the latest research shows, is that these stem cells are still very unique in a way that they're not becoming another cell, but they're basically signaling, promoting, excreting all types of biomolecules that are then able to repair their damaged tissue. So it's a different type of action. So Kaplan says, hey, that's great. I love research. So I'm not going to call those MSCs, mesenchymal stem cells, anymore. I'm going to call them medicinal signaling cells, because they have more of a signaling action in the body, getting the whole team together to get the repair work done. So that's what stem cells are. They are able to, you know, get a team together and go to the site of the damaged tissue and not only repair it, but renew it and re-engineer it. So that's what stem cells are, Sean.
That is really amazing. I mean, like, just the thought of that. And, you know, I still go back to your previous stuff too, talking about the trillions of cells that we've got in our body, and they're all, you know, performing thousands of functions. And you get into this stuff and you're hearing it, but it's just so incredibly complex and magnificent that it's sometimes a little bit tough to get your hands around it. But this is why it's such exciting stuff to talk about. So where do stem cells come from? Where are they in the body? Where do they come from?
Well, there's different sources of stem cells, right? We can get stem cells from our own body. They're called autografts. So we can get them from our own adipose tissue, which is our fat tissue, usually through a liposuction in the flank. We can also get them from a bone marrow extraction, which, by the way, is very powerful. So the first source, we can get them from the patient's own body. We also can get them from human tissue. So from another person's body, right? Not really body, because with human tissue, I'm talking about birth tissue. So we're talking about placental tissue, and we're talking about umbilical cord tissue. And another category of that is embryonic tissue. And I'll talk about that a little bit later, because that's where we have the moral and ethical issues. So we can get it from other humans, birth tissues and embryonic tissues. We can get it from ourselves, fat or bone marrow. And theoretically, we can get it from animals. But in the United States, there's no animal product, so we're not going to talk about that today. Now, let's talk about those embryonic tissues, because there's a lot of confusion there, right? When we talk about stem cells, a lot of people get upset because they are coming from the aborted fetal tissue, the embryonic ones. Now, let me clarify that, yes, there's moral and ethical issues for that, but embryonic tissues, never have been used on humans. They are illegal to use on humans, not because of their moral and ethical issues, but because when we use these embryonic tissues on mice in a laboratory, all those mice end up with teratomas, which basically is a fancy word for, cancers or tumors. So therefore, these embryonic tissues never have been used on humans. They're only used in research. So even healthcare professionals are confused about that. Our politicians try to dismiss the potential benefits of stem cells in the future of medicine because they wrongly assume that stem cells have to come from the aborted fetus. And it's totally not true. As you already know, we can get it from the placenta and the umbilical cord, which, by the way, is after birth, right? Because if the mother delivers the baby, normally the placenta and the umbilical cord are disposed of. Right? So that's after birth. There are no moral or ethical issues, or you can get them from your own body. So those are the different sources where we can obtain those stem cells from, Sean.
So what sources would you recommend for people out there?
Yes, I mean, I don't even waver in saying that because there's thousands and thousands of research articles out there that all agree that the best source of stem cells is our birth tissue, the placenta and the umbilical cord, right? Now, unfortunately, in our conventional medicine world, we have a lot of orthopedic doctors that have been told by their boards or whatever that they need to do a liposuction or get the stem cells from the bone marrow. There's many disadvantages to that. And at the same time, it's not as effective as the birth tissue. So, Sean, I don't know why they're still doing it, but they are, just like they're doing so many other things that are outdated and not working, but they are. So let me share with the viewers why I say this. And there's thousands of research articles, but if I have to come up with the top 4 or 5 reasons, number one, when you're going to use your own stem cells from your own body, you'll have to have that liposuction or that surgery. And as you know, all those procedures come with risks and with recovery times, and it's totally unnecessary. So that's the first thing to consider. Second thing to consider, a lot of these procedures is what we call non-standardized. What does that mean? Let's say Sean goes in to one of those orthopedic places where they're going to try to get his fat cells, right? And you undergo a liposuction. So when they do that procedure, they'll end up with a certain quantity and quality of Sean's stem cells, correct? Now I go in an hour later and I get the same liposuction done. And I also get a quantity and quality of stem cells. Is my quantity and quality of stem cells going to be the same as yours, Sean? No, we don't know. So it's non-standardized. It's uniform. We really don't know what you're getting, right? So that's number 2. It's a non-standardized procedure. You really don't know what's going to happen. But number 3, and this is the most important part, I think, when we get stem cells from our own body, there's usually not enough that they can extract from the bone marrow or the fat cells. And that's why when they're done with the procedure, they tell you to come back later that day or the next morning. Why do they tell you that? Because now they got to put those few stem cells that they got from the procedure, they got to put them in basically in the Petri dish and start amplifying them. In other words, multiplying them. Now, research shows very clearly that we make a copy of a copy of a copy, just like with an original and a copier machine, you can't read it anymore. In other words, research shows that these copies of those stem cells, the replicated ones, are far less in quality, far less effective than an original stem cell, right? So when people start doing research, they're easily distracted by how many stem cells certain products contain. The first question they should ask is, well, are these original stem cells or they're replicates? Because those replicates, you can have a much higher number, but they're not going to get the job done, right? So that's the first thing. And the reason why I say this is because what most people don't know is that, again, our body makes its own stem cells, right? But when we're young, when we're a newborn, 1 out of every 10,000 cells is a stem cell. But as we age, that number drastically declines. For example, when we're 50, 60 years old, only 1 out of 200,000 cells is a stem cell. No, one out of, and I'm looking here at the numbers because I couldn't remember those. So when we're newborn, 1 out of 10,000 cells is a stem cell. When we're 50, 60 years old, Sean, us, only 1 out of 2 million cells is a stem cells. So what I'm trying to say is, as we age, the number of stem cells in our body drastically declines. And not only the quantity of stem cells drastically declines, but also the quality. Because if our stem cells would work, why would we have to take them from one area of the body and put them in another area? Think about that. It's common sense. Why do we get them out of our fat tissue or bone marrow to then put them in our damaged shoulder? If they would be working, they would be working. We wouldn't have to relocate them, right? So in summary, the stem cells that we get from our own body, they are lower in quantity and quality because those both properties reduce drastically as we age. And therefore, they need to amplify and replicate them so they have enough stem cells to inject them later, but those copies are also far less in quality. So that's why you don't do those procedures. Now, when we choose stem cells from birth tissue, placenta, and umbilical cord, those are the stem cells from a newborn, right?
Right.
Day one. So that's the highest quantity and quality available. And so when we inject those into our body and circumvent the procedure to obtain them from our own body, we have a much better response. And it's that simple, really. And there's plenty of research to back up what I just said.
Yeah, you made some great points. Now, you know, I'm in the medical industry, not in your capacity, but as a person that sells medical equipment. And I know we sell a lot of portable black and white ultrasounds so that they can do needle guided injections. And many times they're using those for stem cells.
Yes.
And to your point, and I don't know if you know the facts statistically, but I do know also that when you go through the process of taking it out of the fat and going through, I guess they throw it in a centrifuge and spin it and whatever, but there is a fairly significant amount of cells that don't make it through that process also. So in addition to them having to, you know, sort of regenerate and do that, but a lot of those stem cells through those procedures, from what I've read, you know, it's not the ideal way of doing it, perhaps.
No, exactly not. So I agree with that. We need to get the stem cells from birth tissue. Now, the other thing I want to mention, which is very important, is that, you know, there's too much focus on stem cells because we need to look at the bigger picture. And the bigger picture is what's called in science tissue engineering. Because when you want to repair a damaged tissue in your body, whether it's the osteoarthritis in your knee because your cartilage is wearing out, whether it's a rotator cuff tear, whether it's plantar fasciitis, it doesn't matter. When you want to repair something in your body, right, we need a lot more than just stem cells. And so it's not just about the stem cells. The best analogy that I have is that of a roofer, actually. And we just had hurricane season here in Florida. Ian came through and you know, I mean, it did a lot of damage, Sean. I mean, even in our community here, probably yours too, there's still a lot of people trying to recover. So hopefully that works out well for them. But when a hurricane comes through, often there's roof damage, right? So now if you want your roof repaired, I assume you'll have to call a roofer. It's not going to repair by itself, and the roofer doesn't know if you have roof damage, correct?
Correct.
So you need to call upon a roofer. You need to stimulate, activate a roofer. That would be your first step. In the body, it's the same thing. The stem cells may be there, but they need to be activated. They need to be signaled. They need to be told, hey, you need to go to this address because you need to go fix something there. And so in the body, it's the growth factors that signal and activate the stem cells. So now growth factors become a crucial component of tissue engineering, repairing something in your body. Next, let's say that the roofer shows up at your door, rings your doorbell, and he's there, he's at the right address, but he forgot his toolbox. Is your roof going to be repaired?
No.
They're going to be repaired. Same with the stem cells. The stem cells need their tools. So they need cytokines, for example. They need hyaluronic acid. They need exosomes, etc. And so we need all those what we call biological molecules or components, which is the toolbox of the stem cells to get the job done. And last but not least, Sean, we need scaffolding. Scaffolding basically is that we need to fill up that hole in the roof. We need some of those materials, not just the hammer, but also the nail, not just, we also need the wood, we need whatever it is, the scaffolding, which is the framework from which to build, rebuild, and re-engineer, right? So now, you know, when you're a consumer and you're looking at stem cells, don't be distracted by the number, because we know if the number's high, they're copies and they're not high in quality. Don't be distracted by the hype of stem cell. Questions that you need to ask are, for example, okay, you got stem cells, you know, of course, where do they come from? But at the same time, it's like, what other biological components are in your product? Are there growth factors? Is there hyaluronic acid? Are there exosomes? Where does the scaffolding come from? Because again, as the roofer, we need to call them. The roofer need to bring the tools, and we need also the materials to get the repair job done. If any of those components is missing, your result's going to be disappointing. Okay. So in order for tissue engineering, yes, we need those stem cells, but we need growth factors, bioactive molecules, and scaffolding. And one last thing I like to say is a lot of people heard me say exosomes twice now, and that's getting more and more popular, the name exosome. So what are those exosomes? Exosomes are basically balloons or vesicles that are floating around, and those balloons or vesicles are containing the tools that the stem cells need to repair. So I also can say it's like your Home Depot. You know, it's like your Lowe's. So there's an injury, and we put the Home Depot right next to the injury, and now the stem cells can run in and out and go to the appropriate aisle and find the tools that they need in order to get the repair job done. So those are the exosomes. It's your Home Depot, it's your tool bag, basically, right? And so, of course, they're not hammers, they're nails, they're lipids, and they're proteins, and they're amino acids, and they're messenger RNA. It's those types of tools that the stem cells will need to repair and re-engineer the damaged tissue.
Wow, that's great stuff. So do stem cells, do they fix everything? Is there limits to what they can do, or what are their capabilities?
Their capabilities are endless, and scientists agree that stem cells are the medicine of the future, and that's why, you know, it's not just an opinion. It's first of all, they agree, but secondly, if you look at the amount of research which I mentioned earlier, it far surpasses the research in any other area in science and medicine. You know, so that's where the research is, what these stem cells can do. Basically, it's limitless, because think about it. If anything is aging, like your organs, right? They become less vital, they expand less because they're becoming fibrotic, they're scarring up. You know, their vital functions become less. Your muscles, your tendons, your cartilages, it's wear and tear. Your discs are degenerating. Everything is wear and tear. What if we can put something in the body like these stem cells and the bioactive molecules and exosomes to not just repair it, but also renew it, tear the house down and build a new one, versus patch, which is usually what surgeries and injections is like, this very short-term hiding of the system, or a patch repair job. Oh, you know, I had a neck fusion. Oh, great for you. I'm sorry for you, but you patched something up. What if we could replace those bad discs and that bad vertebrae with a real new one? What if your body could repair and regenerate that tissue? What if your knees are worn out and the doctor said you have bone to bone and there's only a minimum amount of cartilage left? What if we can inject the cartilage that is left, the little bit that is left, with, you know, a stem cell product that has all the other components for tissue engineering, and it regrows the cartilage from there? Then we don't need a knee replacement. We don't need the Orthovisc or Synvisc injections, and the list goes on. So yes, the possibilities are endless, even when it comes to organs, the lungs, the eyes, the brain, anything with a stroke, Parkinson's, MS. If we can get those stem cells into the brain, which we can talk about later if you like, on how that works, they can start repairing and re-engineering also. When we talk about dementia, Alzheimer, the research on those things is out there. And it would not be harmful to do those procedures because there's really no side effects. But obviously, we are blocked or prevented from legally performing most of these procedures in the United States, because we all know that the big pharma rule, and the big pharma have their hands in politics, and the FDA and the CDC, and that's a whole other topic. But that's why many of our top doctors, Sean, they have clinics outside of this country to do procedures that work very well, that can, help with Parkinson's and autoimmune diseases, and you name it. But they are legally not allowed to do these procedures in the United States. And so, so people can go there to get it done, but now we are limiting, unfortunately, ourselves to people that can afford it, right? Travel there and do a cash-based procedure. So that's where the politics and the propaganda come in. But from a pure scientific point of view, there wouldn't be any limits to what stem cells could do in the body.
Wow, that's amazing. So technically the technology is out there now, and it is being done in other parts of the world. We're just not seeing it here in the States, but many times it's invented here because we got bright people and doctors come up with things and procedures, and then it's banned, and then other countries find the same things, right? Because it's usually this greater consciousness that on the same day, two people invent the same thing because they're tapping into that consciousness, right? Yet another topic, but many times it happens in different countries that, we're coming up with the same ideas. For example, in Israel, they're always ahead with research because they're not, basically locked down with all the procedures that had to be done in doing research as here in the United States. But Israel, Korea, those types of things. There's countries, Sean, where if you have a heart attack, they actually could go and take a piece of the healthy part of the heart. Then they put it in a Petri dish, they add the stem cells to it, etc. Whatever they do, they inject it into your femoral artery, go straight back to the heart, and it rebuilds a whole new heart. That is possible today. So why are we doing it? I wouldn't make any money, right? Nobody would have heart disease. But we can, same with type 1 diabetes, if we can get the pancreas injected with these stem cells, it could repair and regenerate and renew and re-engineer, any organ. And in other countries, they're doing it. Over here, it's not allowed. Yeah, which, I think I think people are getting pretty hip to kind of the way that the world is being run these days. And if they weren't a few years ago, they've definitely gotten there now. So Dr. Mike, a little bit off the subject, but still on the subject, you're familiar with the term medbeds?
Yeah.
And medbed technology. So what about like regenerating a limb? Like what about, do stem cells have the ability to do that? Are we there yet with that type of technology?
Well, not yet, but that's where the research is today. It's the research is basically in the areas of genetics and stem cells. So that's where most of the research is. It's also in transplantation because we want basically an unlimited supply of organs that we can give to people without immunosuppression. So that's today, that's where the research in stem cells is how can we get an unlimited supply, because we know how many people, thousands of people are on waiting lists for organ transplants.
Right.
So stem cells would be able to create these organs and we would have an endless supply. But of course, there has to be, because now we got to get the right donors, right? So the research is, okay, what if we can make this universal and we don't need a donor with a certain blood type, but we just have these, basically kidneys for sale at Walmart, right? At Walmart, so to speak, on demand. So that's where the research is. And then also in the areas of cancer and birth defects. So those are the three areas where the stem cells research is really looking at today. And so when you say another limb, yes, so we would have legs and would have arms and would have all kinds of organs on demand, and at the hospitals to put them in when something goes wrong, versus having to put somebody on a waiting list. So that's where we are research-wise. That's not in practice yet, as you know.
Right.
But by the age 2000, it's been said many times over, by 2045, we will reach singularity, which basically means at that point we should all be able to live 140 years old, but not being old. The 100 will be the new 30.
Right.
Yeah.
So how do we know that stem cells are safe?
Really good question. Because it's a lengthy procedure, right? So let me walk through that process, as you will, without too many details. So first of all, when it comes to these birth tissues, we have hospitals that are certified to procure those. Because again, when the baby is delivered, normally the umbilical cord and the placenta is disposed of. It's gone. But now we'll keep them. And then in a hospital, what they do immediately, they're going to test these tissues for what? Any possible infectious disease, transmittable disease, bacteria, molds, heavy toxins. So after the testing in the hospital, most of those tissues are still disposed of, because what we're looking for, Sean, is that perfect, clean tissue that cannot transmit any disease to the end consumer, right? So now once we have that in the hospital and it's tested for everything, it's donated to a tissue bank. And a tissue bank now basically is going to prepare it. It's going to do more testing. It's going to cryopreserve it. And package it basically for the manufacturer. So now the manufacturer can buy tissues from the tissue bank, and then the manufacturer has very strict regulations on what they can do with that tissue. It can be only minimally manipulated according to the FDA, and there's obviously a whole chapter on what that means. And so now it's in the hands of the manufacturer. There used to be a lot of manufacturers that made those kind of products, but in 2020 the FDA closed about 80-90% of them based on new standards that they came up with. So now the stem cell products today are basically made in a FDA approved lab, where usually also medicines are made and things like that. It's usually an ISO 5 lab, which has to do with the cleanliness and the amounts of times they test the tissue. So I believe today the tissue, even if they got the tissue from the tissue bank and they made their product, they're not going to put it straight in inventory. They still have to keep it and test it multiple times before, just to make sure it doesn't grow any molds or bacteria in the meantime, before it can go into the inventory. And then physicians can obviously buy it from manufacturer. But what I want to say here, Sean, is that from the first step to the last step, every single one of those steps is strictly monitored by the FDA and the American Tissue Bank Association. So from the product itself, and there's been millions and millions of injections done, there has been zero side effects or adverse reactions. What people may want to know too is, again, the umbilical cord or placental tissue is a universal tissue. What does that mean? There's no genetic information or material from the mom, and there's no genetic information from the baby. It's in between. It's universal tissue. It can be used on any human, okay? And so we don't have to do any blood typing or blood testing for it, because this tissue does not contain any blood or any blood fragments. So therefore, it's regarded 100% safe.
Wow.
Yeah.
That's really, really amazing. So I just want to go back to something you said earlier, because you brought up something that I get a lot. I get a lot of people I talk to that have issues with no cartilage in their knee, and it's bone on bone. And we were talking earlier, and you said that there is the ability now to put injections and do that. But that's, if somebody had that condition, that wouldn't be something that they could address here in the States. That would be something.
Yes. So we talked earlier a little bit about, about the pancreas and type 1 diabetes and rebuilding a heart. We can't do that with stem cells in the United States. But what we can do is any orthopedic condition. So any tendon, any ligament, any muscle, any arthritis in the knee, that's all legal, available to do in the United States. On top of that, the other conditions that we treat here on neuropathy, most people do not know, but as a CEO of a stem cell company from 2015, Sean, till COVID started 2019, we probably did over 1,000 patients, including many top athletes, because we had a very specific procedure and a synergy with some other modalities that worked very well. That's why we attracted those athletes. But over 50% of our total patients were patients with neuropathy, because we had a crazy or amazing results with neuropathy. So we have our orthopedic conditions, we have neuropathy. It also works very well on lung conditions. Research supports that too. So we're talking about COPD, emphysema, chronic bronchitis. And there's two ways of we could do that, John. One is what we call off-label. In other words, they don't like you to do it because it's off-label. But I always smile when that word is used, because Let's take neuropathy for an example.
Mhm.
There is no medicine out there for neuropathy. There is no treatment out there for neuropathy, because if you talk to a neuropathy patient, or if you know about neuropathy, there's 4 or 5 medications they use off-label themselves. Thousands of physicians prescribe millions of patients in the United States an off-label drug because they use either Lyrica, Neurontin, Cymbalta, or gabapentin. Okay, but what are those drugs? They are seizure drugs. They are designed for seizures, and our doctors prescribe those to patients for neuropathy because they can help manage the pain. And I have to be honest, when I talked at the time between 2015 and 19 to hundreds and hundreds of neuropathy patients, I have to be honest with you, Sean, a lot of them would have more pain without these medications. But meanwhile, the neuropathy is getting worse and worse and worse, and it's evolving because nobody's taking care of the cause of the neuropathy problem. So again, when people say off-label, I just smile, because they, regular doctors do it all the time, use medication that's not designed for something and prescribe it for something else. Or even when a doctor says get some vitamin C, that would be an off-label use for whatever it is that they're prescribing for. So when I say off-label, I don't want people to get scared. Doctors do it all the time, right?
Mm-hmm.
Especially with medications. But for example, back to the COPD and to the lung conditions, if we would do an infusion with these stem cell products or exosomes, guess where these stem cells go first? Where do they have to go if we put them in our vein? Straight to the lungs. Right. That's where they go first, okay? So that's why we have amazing results with any lung condition, because the stem cells bring down that inflammation immediately, so the symptoms will go. But secondly, those stem cells remain there to do what? Repair and re-engineer, because those lungs are fibrotic, they're scarred up, they're not functioning correctly. So we can basically, just like we're talking about a heart earlier, is not inject that organ directly, because we can't do that, but we can get the stem cells there, especially when we're talking about the lungs. Another way of doing it, Sean, is just simply nebulizing them, and then they get straight into the lungs too. So that's a non-off-label way of getting stem cells into the lungs. Then we have all our brain things, right? We have strokes, Alzheimer's, dementia, Parkinson's, you name it. How can we get stem cells in the brain? We can do that with an IV. Research shows that about 6-7% of the stem cells of the IV may pass the brain-blood barrier and end up there. So we'll get a percentage of them arriving into the brain. Often we combine that with, I forgot the name of the drug, because obviously that's not my specialty. But in the emergency room, they use a drug to dilate and open up the blood-brain barrier, especially when somebody comes in the emergency room and their head is swelling because they have a bleeding. And before they drill a hole, they want to try to get that swelling down. And so they use a drug, I forgot the name. So we can use that drug in combination with the stem cell infusion to allow more than 7% of those stem cells enter the brain. And one time, Sean, we actually had a patient that we injected in the nose, because the nose is a direct passageway to the brain. But that seemed to be a painful procedure, so I'm not sure if I would be up for that. Yeah. But that's another way to get an X amount of stem cells in the brain to get the repair and the re-engineering process started. The other areas are the eyes. And of course, this is not an injection, by the way, but stem cells come in different forms. They can come in injectables, but they also come in membranes, which basically is a tissue, a human tissue. And so it's smaller than a contact lens, and you just put it on the white of your eye, and it has all these components of tissue engineering: your growth factors, your scaffolding, your collagens, your exosomes, your stem cell. And so the research mostly is done on dry eyes and dry macular degeneration. But again, that's the research. Just think about it. Stem cells don't go by terminology. They don't want to say, oh, we can't fix that because the research wasn't done, right? Stem cells go to where there's damage and repair the damage, period, right? So it would help with any condition of the eyes too. What else? Sexual dysfunction, erectile dysfunction, great results with those types of things, because it's repair and re-engineer, right? Repair and re-engineer. So those are the things that we can do in the United States: orthopedic conditions, neurological conditions, especially neuropathy, lung conditions. We could try to get stem cells via an IV into the brain, and sexual dysfunction. So those are the things that we can do successfully here in the United States.
That's fantastic, because neuropathy is something I never really heard about 20 years ago, but my goodness, I mean, I'm hearing people with neuropathy on a weekly basis, a lot of people with neuropathy.
I'm glad you bring it up again, because this is not a neuropathy podcast, but there's so many people listening probably that know somebody with neuropathy if it's not themselves. I mean,
Right.
Everybody's got them in the family, and people do not understand. The patients do not understand, and most doctors have no idea either. But it's so simple, Sean, because, and I'll explain it because I think this is great. I always love to explain this to patients. So where does neuropathy come from and what is it? And if we understand it, then we also know how to fix it. That's usually how it is, right? So from the elbows down and from the knees down, we have what we call, all of us, neuropathy or not, all humans, we have small diameter nerve fibers, okay? Now, in neuropathy patients, those small diameter nerve fibers, they are attacked, they are killed off. And so as time goes by, they have less and less of those fibers, which results in pain, burning, numbness, etc. And that then devolves in balance issues and difficult gait. So now they need a cane, they need a walker, they need a wheelchair. It's a progressive thing. Why is that? So let's talk about those nerve fibers. These nerve fibers, they give our brain feedback when we walk. It's called proprioception or kinesthetic, kinesthetic sense. It's proprioception. When you and I walk, Sean, we're not looking at the floor or where we're walking. We plant our foot. There's feedback to the brain. If we feel it's uneven, then our brain tells us, look down, don't fall, adjust your gait. It's an automatic process. The feedback comes from the small diameter nerve fibers. Now, if they're killed off and we get less and less of them, that means we get less and less feedback. That's why people with neuropathy eventually get balance problems. They fall, they need a cane, they need a walker, okay? Now, your question will be, who's killing those small diameter nerve fibers? Who's killing those, right?
Yes.
Well, most people know one cause of neuropathy. It's diabetes, right? Because diabetes is sugar, and sugar is what? A poison. We talked about toxemia in another podcast. Toxemia is all the toxins that we are exposed to or ingest, and they cause an inflammatory process in the body, and they cause free radical damage, right? So diabetes, sugar as a toxin basically attacks the nerve fibers. But most people are diagnosed with what we call idiopathic neuropathy. It's a fancy word for doctors or science to admit that they don't know what the cause is. Cause is unknown. But a little bit of research and common sense tells us that the cause are toxins. So we have two good examples to illustrate that. Number one, cancer survivors often end up with neuropathy. Why? Because they had chemotherapy. And what is chemotherapy? Nothing but toxins. So the chemo killed the small diameter nerve fibers, resulting in neuropathy. Another group that we can look at is our veterans, because they were exposed to Agent Orange. And so many of them have neuropathy, okay? Because the toxins attacked the small nerve fibers. Okay, so in order to fix this, Sean, we really need to do two things. We need to restore the vascularization or the blood flow in that area, because many of those people, the vascularization is attacked. The small nerve fibers don't get the nutrition, don't get the oxygen. Sure, they're killed off because the toxins there's no nutrition, there's no oxygen. So we need to restore the circulation. And as soon as the circulation restores, the small diameter nerve fibers can regenerate. And so with stem cell injections, we have witnessed over and over again, even objectively, because we can take a tissue biopsy and look at the vascularization of a tissue, and then 6, 9, and 12 months later take the same biopsy, and we can see a normal vascularization again. And as soon as we can see that, the small nerve fibers suddenly come back, and the patient loses the numbness or the pain or the burning, but at the same time they can throw their canes and walkers to the curb, and we've seen that many times. Now, the only thing that I want to finish up with on neuropathy is that why do they attack the small nerve fibers, these toxins? Well, our spinal cord is an extension of our brain. And so at each level, nerves come out to supply that area. But in our brain and in our trunk, those nerves are protected by a myelin sheath. It's like a wire that's insulated.
Mm-hmm.
And so these toxins cannot attack the rest of our body. But our extremities, the small diameter nerve fibers, they don't have that myelin sheath. They're not protected. And that's where these toxins attack. And that's why we end up with neuropathy in our extremities and not in the rest of our body, because those large diameter nerve fibers have that myelin sheath that protects them.
Got it. So, so you said sugar plays a role as a toxic material. For people that are feeling the onset of neuropathy or have neuropathy, how much of a role is that playing? Is cutting back and being conscious on your sugar intake, is that, once it's set in, is that going to have any effect on getting you like back to restoring those? Or,
well, think about type 1 and type 2 diabetes, right? Everybody agrees, even though that's not what's happening, that type 2 diabetes can be 100% controlled with diet, right? But they'd rather take the medicine than adjust their diet. But even conventional medicine agrees that it could be controlled completely with diet. But I would say, Sean, again, is look at the bigger picture of toxemia. So yes, cutting your sugar will help, but there's another hundreds of things that we can do to reduce toxemia in our body, right? So we need to get man-made foods and drinks are loaded with artificial colorings and sweeteners. And our drinks too, there's no nutrient value to it. It's all chemical toxins. Our electromagnetic radiation, our air, our water, it's all polluted. The chlorine from our chlorine fumes from our shower, the exhaust gas from cars. There's a constant onslaught of toxins to our body, right? So whatever we can mitigate and minimize, we have to do, and it will help us to keep toxemia in check. And if we can keep toxemia in check or under control, we keep systemic inflammation under control. And even according to conventional medicine, systemic inflammation is responsible for over 90% of all disease. So that's why, to me, health is easy on a theoretical level, because all we need to do is keep toxemia in check, make sure we reduce the exposure and intake of toxins, and simultaneously increase the intake of nutrients and supplements, for example, that combat free radical damage and systemic inflammation. And if we can do that, disease has no place.
Wow, that's super exciting. That's great information. And like you had said and I had said, I'm just dealing with so many people with neuropathy. So I'm really happy that you kind of just gave us a little more in-depth information on that, because the number one thing that is just great to hear is that there is hope for people dealing with that there are things that can be done to mitigate that and address that. And I think that's really...
Here's what some listeners are thinking, Sean. Just came to mind. They say, yes, but I'm not a veteran. I wasn't exposed to Agent Orange, and I didn't have chemotherapy. So that didn't do it either. And I don't have diabetes. Well, that's why they call it idiopathic too. It means is you were exposed to a toxin in the past, and we don't know what toxin it was. Maybe you were working at a job that was not safe because there was a release of toxins, and you were handling asbestos, or you were handling this, or you were handling fluoride, or you were handling something decades ago. Or maybe you lived in an old house that had lead poisoning or radon in the walls. We don't know. But what we do know, your body has a toxin in it, and it's causing that damage. Okay.
Wow, super exciting. So I want to talk about your facility that you had up with the stem cells, because you treated thousands of patients. But I just want to reiterate one more time. There's certain things that with stem cells need to be done outside the US, but orthopedic, neuropathy, COPD, those are things right now here in the States that you could seek out and get stem cell treatments for. Is that correct?
That is correct.
Okay.
What I would say, and again, I wrote this, Sean, you have a copy too.
Yes.
It's this Stem Cells 1-on-1. It's such a tiny little book. It reads in an hour probably. It's big print too, and it's written in layman terms, because especially now there's many people offering stem cells, and so as a consumer you need to be aware. And I put here 7 key questions that you need to ask when you're considering this therapy. And one of the questions is obviously, where do your stem cells come from? Mm-hmm. What about the other components? Are they in there? Mm-hmm. Who's doing the injection? Dr. So-and-so, how many injections has he done? Mm-hmm. I'm here for neuropathy. How many neuropathy patients has he done? And what is the success rate of those neuropathy patients, etc.? Because unfortunately, especially people in pain, Sean, often they're desperate and they will reach out to a facility that does, procedures that your conventional medicine doctor won't offer. But at the same time, I need consumers to be cautious, because there are a fair amount of, what I call fly-by-night organizations and clinics that try to take advantage of vulnerable people that are in pain and that are desperate, and take their money, knowing that the procedure probably won't work. So this little consumer guide is important to learn the questions that you need to ask to make sure you're at the right place to get these procedures done. So be careful where you go, ask the right questions before you, pay for this. Good news though, Sean, when we at the clinic from 2015 till 19, insurance was not involved. This was cash-based. And I gotta say, it's usually, depending, there's a big range from anywhere from $3,000 up to $8,000. So it's a lot of money. Mm-hmm. However, today, there are certain products that have been approved and are covered by insurance companies. So that's another thing you may have to look at today, like, does my insurance possibly cover a certain product, and where do I go to get this, right? Mm-hmm. That way you can't be out of pocket on some of these procedures. So that's the good news.
That is good news. So you've treated over 1,000 patients with the stem cell therapy, stem cell treatments. What were the success rates like? What was your success rate, and what did you learn about the whole process from seeing so many patients?
Yes, I'm going to correct you. I didn't treat them. My company did. I was a CEO.
Did. Okay, I'm sorry.
Just for the viewers to make sure. I had a medical team that did the procedure, so I didn't inject anybody myself. But I was a CEO, and I was the one who did the educational portion and the PR. So obviously I had to know everything about it in case there was a question, even if it was a medical question. But looking back, Sean, we did about 1,000 people. I would say 400 or 500 were, half of them were neuropathy. The other 50%, 40% probably was orthopedic, and we're talking low backs and knees were the most popular, followed by shoulders and all the other joints. Mm-hmm. And then 10% was everything else, because it was considered off-label. And it doesn't mean we can't do off-label, but we have to have the right paperwork signed, to get that done. And so I would say, because I get this question often, and this is 100% honest, I would say that 60% of those people get a miraculous result, and the others get no result at all. What does that mean? It means that it either works, and if it works, it's like, oh my God, my neuropathy is gone. I don't need my cane anymore, which is almost like a miracle, right? Or it's like, oh my God, I spent $3,000 and I feel no different. This did not work. Mm-hmm. And so, is that a good success rate? If you're one of the 60% with a miracle, I would say it's worth trying it, because there's no possible adverse reactions, unlike mm-hmm. many other procedures, surgeries, etc. out there. So from that point of view, you have nothing to lose. And then the next question I usually get, Sean, is like, so who's the 60% and who's the 40% that it doesn't work on, right? And looking back and discussing it with my team, I would answer the following. If you are a person that has many other medical complications and issues already, in other words, you're a little bit older, you're overweight, you got metabolic syndrome, you got diabetes, you already had a heart attack, you're on all these medications, you are more likely to be in the non-responders category. Because probably your body, when we inject it, is putting out fires and has no time to repair your knee, because it thinks your knee is not important at all right now mm-hmm. for you to stay alive, right? Mm-hmm. So that's probably the assumption that I make based on why these people don't respond. But that's usually the people that are less likely to have a good result. Mm-hmm. The people that get great results are the people that are, not in ill health. you know, they may have high blood pressure, but they're still playing golf and they're doing okay, and they're not on too many medications, and they're not under the care of a specialty physician, or they don't get kidney dialysis or anything like that. And so those are the 60% that tend to respond very well. And that's why with athletes, we had 100% success rate, not 90, 100%.
Wow.
Because again, they are in shape, they're fit, they're eating properly, you would assume. And so they respond quickly and fast.
Mm-hmm.
So that's what I would say. You know, but nothing can go wrong. Worst case scenario, it didn't work.
Well, that's good though, because people can kind of, you know, look at themselves and say, am I an ideal candidate for this? Or, you know, maybe there's things I need to work on with other health issues before I address the knee or the cartilage in the knee, you know, and get that fixed. Now, we talked earlier about the exosomes. Am I pronouncing that right?
Yep.
So when you were running the clinic back in 2015 to 2019, were those around? Was that part of the component that you were?
They were doing research on it, and that was exactly when those first exosome products and companies came out at the latter end of that. So again, we already know the answer. If everybody was listening, exosomes are great, they're the tools. But what are they going to do without the stem cells?
Right.
Who's going to take the tool out of the toolbox? What are they going to do without scaffolding? Right. So now, if you are young, Sean, and you still have a lot of stem cells, maybe that will suffice. Because you have stem cells in your body, you're still young, you're a teenager, or I know what, you hurt yourself playing soccer, and you get the exosomes. Again, we don't know what components are in the body and what the quality of those components is, and etc. So I'm a proponent of making sure that all the components that are needed for tissue engineering are delivered to the body for the best results. You probably heard about PRP before.
I did not.
Okay, so PRP is very popular too, and it's confused with stem cell therapies, but it's not stem cells. So PRP is a procedure where the doctor or the physician will draw blood, spin it in a centrifuge, and separate the white and red blood cells from the platelets. Then they're going to take the platelets. It's also called liquid gold, because the platelets contain growth factors. Do you remember what growth factors do? Those are the signaling molecules. They are waking up the stem cells and say, hey, come over here because you got to repair something. So let's say we now inject those platelets, which basically means a good source of growth factors, into your injured shoulder or rotator cuff. What that does, these growth factors say, hey, stem cells in the body, come over here and fix this. Now, if you're young, you may get good results because there's still stem cells, a fair amount maybe, and they still have a decent quality. In other words, they can get the job done, you know. But if you are older, we already know that the quantity and quality of your stem cells in your body drastically declines. You basically are calling a roofer that cannot climb the ladder. Nothing's going to happen, right? And so PRP could be beneficial for college athletes and younger people, or could be beneficial in combination with stem cell injections, because if you do your stem cell injections today and in X amount of time you put some more PRP in there, then you're activating those same stem cells again. So in combination with stem cells, it would be a good choice. For younger people, it may work and it's less expensive than stem cells. But for the older people, that procedure will be disappointing because the growth factors are signaling something that's not there.
Right. So with the advancement and the knowledge of these exosomes and with the role that they play with the stem cells, is that, in your opinion now, is that going to enhance the results that people get because we're finding other things to combine with those stem cells to get a better result? Is that, where do you see the future of everything going right now in this field with the stem cells?
Yeah, it's more and more research. Like I said, we talked about the topics: cancer, birth defects, an unlimited supply of transplants, and then, you know, altering our genes and genomics and fixing those, right? But when you talk about exosomes, yes, you know, so we have the stem cells, we studied those, then we figured out we need all the other components. One of the components is exosomes. Let's study those. So now we have studied those, and to me, yes, an exosome infusion or injection is great. because it's a component that we need, but in order to be effective, we need all the components. That's all I'm saying. Now, when we were doing the stem cell injections before the exosomes came on the market, we still had great results. So people may ask, so how did you get the exosomes? Because your roofer needs the toolbox, right? Well, where do exosomes come from? The best source of exosomes is amniotic fluid. Amnion is a fancy word for placenta. So, you know, the placenta has fluid, and that fluid is where the exosomes come from. So the products that we injected, Sean, and this is a good finish actually, because we were talking about the sources earlier, right? So what source do you want? And everybody's focused on stem cells, and we get the stem cells. Now, what about the other components, right? So the products that we used had all the components in it, because the manufacturer that we used had a product that contained the placenta, the amnion, which has the exosomes, because they're in the placental fluid, has the scaffolding and the collagens and the biomolecules. And then they combined that amniotic tissue with the Wharton's jelly of the umbilical cord, because according to science, that's the highest source or viable source of stem cells, mesenchymal stem cells. So if we combine those two tissues, we have all the components that we need for tissue engineering. And because the placenta was in there, we had our exosome source also. So what we did is we just didn't inject exosomes or stem cells. We made sure that we had all the components that were necessary for tissue engineering.
Fantastic. And that's great information. Now, before we wrap up, you're offering a very special offer right now through your website, which we're going to have the QR code, and I'll also put the web address on here. But you're going to do a 20-minute one-on-one with anybody that's watching the video that wants to get more information and get into sort of a mentorship program with you. Is that right?
Yeah, what I'm doing is post-COVID here, Sean, I'm finally starting to do what I like to do again, because I do like to do conventions and seminars and talk to people and educate people. That's where we met, right? At a convention in Orlando. So I have a passion for that, because I can reach a lot of people at the same time. And so what I put in place here post-COVID is mentorship programs. There's 3 different programs. And so what I do is I don't inject stem cells. I don't provide technology. I don't make my own supplements. But what I do know, I know everything that's out there. I know the best sources. I know the best supplements. I know the best physicians. I know all that stuff, right? So what I do is when I do a seminar or a Zoom call, I provide people with my website or a QR code. When they go to the website, they obviously can learn more there, but they can look at the mentorship programs, but more importantly, like you just said, they could schedule the calendars right there. You pick your date, you pick your time. They can schedule a Zoom call with me. And the purpose of that Zoom call is I will identify where you are health-wise, for example, and what your medical conditions are, if any. And then I'm going to talk to you about your goals. Where do you want to be health-wise? And based on the information going back and forth between me and the client, we're going to kind of initiate a plan or a strategy. And I'm going to recommend one of the mentorship programs to them. And in the mentorship program, Sean, what I do is I basically be their coach and guide them. So it's going to be very customized, individualized, because certain people may need this and this piece of equipment at home, and may need this and this supplement, and may upgrade their diet this way and omit this way. And let's do this blood test, and let's do this genetic test to find out A, B, and C. So I'm going to customize and guide them to get to their goals, and I'll be relentless, and I will be there until they reach their goals. And so initially 20-minute Zoom call for free, and then see if we can funnel them into one of the mentorship programs so we can get the results, because we can talk about this all day long, but it's action that will make the difference.
Right. And like you said, everybody has something different that they might need information on. So to be able to meet with you for 20 minutes one-on-one, you can really drill down on the personal issues that each individual has and really give them very specific information that's particularly relevant for them. So that is fantastic. Now, your web address is Biohacking Unlimited. I'm going to put that in there. If anybody is watching the video, go to the website. There will be a QR code, but you can go directly to the website, get more information, and then, like Dr. Micah just said, also schedule a individual one-on-one consultation, which is absolutely fantastic value to be able to spend that time with you. So, Dr. Mike, in conclusion, is there anything else you'd like to say before we call it a day here with this call?
No, I mean, it was a great call. Hopefully we cleared a lot of confusions and myths about stem cells. Again, even on the website, if you go to the other page, there's 6 or 7 of my books. This is a very cheap $5, $6 book. I don't even know how much it is. Proceeds of my books always go to charity. So this is not a moneymaker. This is for you to basically get a recap, of the 7 questions that you need to ask when you're considering these types of therapies. But again, Sean, these are good alternatives besides steroid injections or surgeries, replacements, knee replacements, hip replacements, low back pain, fusions. Please use those things as an absolutely last resort when it's threatening your life, because I've seen tens of thousands of patients as a physical therapist. And so I see how patients may initially have short-term relief from those procedures, but usually end up in a worse situation years after these procedures for many different reasons. So look into regenerative medicine and less invasive, less harmful procedures to, fix damaged tissue in your body.
Fantastic. Dr. Mike, once again, thank you so much for taking the time to be on with us today. It's greatly appreciated. Once again, I'll have the link to the Biohacking Unlimited, and we'll also have a link to the book, Stem Cells 101. It's been a great call today. Thank you once again so much for your time.
Thank you, Sean, for your time, because without you, the word doesn't get out and people don't get the help they need. So bless you.
God bless you, sir. Have a great weekend. We'll talk again soon.
Okay, sounds good. Thanks.
Bye-bye.